breakfast that's ready in a snap.
And it will be
Lunches you actually...
Stress can be overwhelming.
Oh, sorry, Crystal, we have to finish up. And I'm going to be traveling for the next 2 weeks.
Sorry.
Yeah, I'll be back on the 27th. We can resume our normal time then. Okay?
Okay. Works for me.
Good. Hurry up, because I need you to help me with this Zoom.
You know me better than I know myself. Every time we talk, my tears swell. I told you all about my weird sex dreams. My sweet therapist, Jan Gray, PhD. I know I pay you to talk to me, but sometimes I pretend it's free. Now you're on vacation, don't know what to do. Jan Gray, PhD, I wanna self-care with you. Talking is easier in warm lighting. I wish I knew what you were writing. If I see you at Trader Joe's, I won't say hi, 'cause I know that you have your own life. I know we can't be friends in real life, but sometimes I pretend in my mind. If you ask me, your advice is priceless, but thank God my insurance provides this. I bet you live in a cottage with a lot of house plants, have a loving husband who makes time for romance. You try new foods, you travel far, could afford better, but you drive a practical car. I bet you finish every book that you start, and the walls of your house are fucking covered in fine art. Jan, girl, I just want to tell you that I love you. Not romantically, but in an I wish you were my mom kind of way. You came up in my People You May Know on Facebook, and I thought about looking through your photos, but I didn't. I respect your privacy. Okay, fine, I lied. I looked at the photos multiple times. It seems like you had a lot of fun at Machu Picchu, and your hair looked way different in 2014, but still cool. Okay, I found you on Instagram too, and YouTube and Venmo, and I saw that you paid someone named Yasmina for ceramics class. Is there anything you can't do? Also, objectively, you're attractive. That's neither here nor there. I know I pay you to talk to me, but sometimes I pretend it's free. Want you to trust me too, and know this. If I cancel, I'll give at least 24 hours notice.
It seems like this longing for my acceptance comes from the distance your father created during your formative years.
Damn, that's right on.
all right. Sorry, I was looking for my presentation, everybody. Okay, I hope you found that entertaining. I sure did. So if you're not entertained, at least I am. So now to the more important stuff. And I just want to say that I will make time for questions, usually towards the end of a topic, because we're going to have a few topics that we're going to be discussing today, as you can see from this very long title. So it's a long title because basically we'll be talking about things like neuroplasticity through child language acquisition, especially when we're talking about bilingual and multilingual children. But underneath all of that, I just want you to always kind of go back to neuroplasticity, and then also go back to like, how is this about teamwork? It is about teamwork because doctors need to know this. Counselors need to know this. Speech therapists need to know this in order to be able to help a child that's struggling, or whether to figure out, is this child really struggling? Now also we will be talking about genetic traits that make us all very different. And why do we need to know this? Because we're all very different. And doctors and psychologists and clinicians, all sorts of clinicians, and even I feel that teachers very much are part of the health field as well, because I mean, come on, they teach our kids from such a young age, not only the topics that they're taught at school, but also manners and discipline and all sorts of other things. And they are the ones that see our kids for so many hours out of the day, and can absolutely notice things going on, or sometimes might notice something that might be nothing, but it's kind of, that's why it's a team. It's a team project. We need to keep it a team project. So again, I'm Dr. Monika Siedlarz. I'm a pediatrician by training. I've practiced for quite a few years. I practice in Oregon, and I just decided that, you know what, general pediatrics is fun, and I love the babies, and I'll totally miss them, but I really love development and behavior and wellness, and that's what I'm focusing on. So I'm not the only CEO around. Along with Kim, here I have Zenflower Integrative Pediatrics here, and I am found here at Beyond Healing Counseling and Wellness Center, where I see patients with any kind of concerns that I could help with. But anyway, that's kind of me there. Second of all, I've, you know, the big thing, I've got nothing to disclose. I was not like paid a big amount of money to do this talk. I really wanted to do this talk. I was asked. Let's face it, most of this is actually about me. And I really like to talk about myself, and maybe that's a little narcissistic, and you're all probably going to be analyzing me throughout this talk, but I am multilingual, and I have a special genetic trait that I'll be talking about. And so, yeah, you probably know a little bit too much about me, so sorry. And some warnings. I'm a pediatrician. I actually posted that picture, unfortunately, when I got my diploma out of residency training, and it was like, now you're on your own, good luck. I'm bound to leap into Disney songs, just be warned. And I tend to swear in weird ways, like, and I say poop and oh darn shit, or, you know, whoop-de-doo. So just forgive that, please. Do you really want to know my resume? I know everybody kind of, when they do big talks, they kind of, this is the school I went to, and these are all the diplomas that I have. And well, trust me, I graduated. I have diplomas. I have research. I have a book chapter. I have lots of writing. And if you really want my resume, I have no problem sending it to you. Let me know. And I'm not even kidding. I know that I'm maybe sounding a little bit sarcastic, because I can be sarcastic, but this I mean for real, that if you would like to know more about me, please do contact me. And I'm more than happy to share that information with you. Okay. And so again, you'll learn about me through this lecture. Story is a way to teach, and it's just a way to connect. And maybe I read too many Brené Brown books and saw too many of her videos, but she's all about story. She's all about vulnerability and sharing. And so here I am, being vulnerable, sharing, and trying to teach through story a little bit. So, and I'm also really lucky that I'm in a phase of my life where I get to kind of choose what I do, and I got to choose what I talk to you about. So all these things that I'm going to talk to you about are really special and dear to my heart. So I really try to put effort into what I present to you. So I do hope that it's going to be valuable for you. So far you kind of heard a lot, but haven't learned anything. So let's get started. And so I warned you, we're going to get started again with a Disney song, and then we're really going to get into like some medical jargon. So beware. But this has to do with this lecture, just so pay attention to pay attention.
Snow glows white on the mountain tonight, not a footprint to be seen. Un royaume de solitude m'a placé là pour toujours. Der Wind heult so wie der Sturm ganz tief in mir. Het wordt mij te veel, hoe mijn best ook deed.别让他们进来看见，做好女孩就像你的从前。Visa ingenting vad du än gör. Allt är förstört. I know, mamma know. 姿見せるのよ。Libre soy, libre soy. Libertad sin vuelta atrás. Sin pres, no tendréis ni estás. Jöjjös orkan. És közben a szívemen ül a jég. Desde la distancia, qué pequeño todo es. Y las cosas que em dominaven per sempre han fugit. Non è un difetto, è una virtù e non la fermerò mai più. Ne manderò, ti giuro che Stadie kraj, na kryli ma vetra stan. Så gick ut, svejsa kan, måtte utan tillbaka. Staki i bakvikar, men jag Kuasa ku buat hidup bercelana. Подвластны мне мороз и лед, вот что за дивный дар. Och som Krystella står in tanke ganske klar. Det spröda bödas när mina låtar Laat ik gaan, jeg skal stige lik solen vår. Når jeg faller så redd, det gir meg hemmelighet. Siedlarz, kanskje lærer vekk efter stormraset. De vrieskou, daar zat ik toch al niet mee.
All right, there will be a quiz at the end, and the first question is how many languages were in that song? Just kidding, there won't be a quiz. I think there was about 27 languages in that song, and I had to add it. I know that's a lot of media for the very beginning, but I had to have it there. It just tickles my heart. So the serious stuff, we'll be talking about language acquisition, specifically looking at multiple language acquisition and in the different ways that it can happen and how the brain changes. And so therefore, underneath that, thinking about neuroplasticity and the importance of teamwork. And then the second biggest topic we'll be talking about is sensory processing sensitivity, which is a genetic trait. It's a normative trait. And again, thinking about teamwork and why would she even bring that up, you know, kind of a thing. So just kind of keep those questions in the back of your mind. So there's a lot to talk about when we are thinking about a multilingual child. The comparisons from monolingual, bilingual, multilingual. What's the difference? How does the brain change? What's the neurodevelopment like? Are there changes? We'll talk about some of the myths and drawbacks and benefits of being bilingual or multilingual. And we'll talk about a lot of variables like communication variables, cultural awareness and stuff like that. we'll talk about how languages, how there's acquisition of language, and all the social impacts, immigration impacts, family, and so on, and things that we need to all think about as practitioners. So there's quite a big interesting myths out there that the child will be delayed if, for example, a child is taught 2 languages at the same time, or starts with one and then another one is introduced right away, that the child will get confused, or bilinguals are less intelligent. That's a big one, and it's close to my heart. I am born and raised in Poland. Again, here you go. You're going to learn a lot about me. And I definitely had this, I've ran into this. So when you don't speak the language or have an accent, you are treated differently. And I definitely see that and saw that as a child in my parents. That was the biggest impact for me, and still is when I see that with my dad. Reducing to one language will somehow make a child more successful. That's also another myth. And so we'll be going through these myths and discovering how the brain changes as we go through. So here's some data. About 50% of the world's population is actually bilingual. And in the US, about 20% of homes speak more than one language. And in big cities, and we're near Chicago area here, or wherever you are, if you're somewhere else, that statistic goes way up in a big city, like 60% in LA, which might be even more. And I mean, how many Polish speaking people are in the Chicago area? Probably a pretty big percentage. In Europe, bilingualism is very prevalent. Obviously, European Union, most people speak English and another native language from their country. And I think this, I have 56% quoted here for the population in the EU of being bilingual. And I actually feel like that's too low. I really think it's probably closer to like 90%, having been to Europe a few times and being from Europe and going back. But there's evidence now showing that there's beneficial effect of bilingualism on children's cognitive development. And also it shows a delay of onset in dementia in aging adults, providing for what is called the cognitive reserve. So those are some really good points and some really good news about being multilingual or bilingual. I'm sorry, I seem to be stuck. There we go. I will just, sorry about that. Okay, just having some technical difficulties that I will get over. Okay, so some history here in the past, in the mid-90s, mid-1900s, excuse me, it's 2020. I still feel like 1990 wasn't that long ago. So in the 1940s, 50s, and 60s, the thoughts were bilingual children face obstacles, and they should only be taught one language, and they have this limited capacity hypothesis. Now today we know much more about babies, and babies can distinguish their dominant language, the L1, the first one that they are taught, that they hear at home, and they can distinguish as little as infants before they're 6 months. They can distinguish sounds of a different language and the language that they hear all the time from the people that care for them. And by 6 months, by 7.5 months, they will distinguish between words of different languages. And by 2 years of it, they will use specific grammatical rules. I think that's amazing. So that shows just how amazing that our brains really are. So the myth, child will be delayed. So this thought is extremely prevalent. And unfortunately, I've seen this among pediatricians. There's no evidence that this is true. On the contrary, there is advantages to being bilingual or multilingual. Bilingualism does not cause a language delay, although language delay can certainly occur in bilingual children, which can then become a kind of a challenge for any practitioner, whether you're a psychologist, speech pathologist, or a physician, to figure out which one it is. And you'll learn a little bit more in the upcoming slides of why that is. The effects of language background are often mediated through language expertise, where those with language-related disorders, that's more affected in deficits of memory and attention. So there will be errors that will be made by children who speak multiple languages, and they don't necessarily mean a disorder. But memory and attention, that's something different. And evaluating for that is what we want to be looking at when we look at a child who speaks one different language or a couple of different languages. So learning a second language does not interfere with the child's development of the first language. But there's a little provisions to that. And of course, we'll talk about that. So the child will get confused. Well, I kind of mentioned that more than half of the world is bilingual. And many places are trilingual, multilingual. And somehow confusion is not the problem. Not this kind of confusion from being multilingual, maybe for other reasons, but not from being multilingual. So people make the mistake of interpreting normal language learning processes and errors as signs of confusion, where all kids make mistakes when they learn a language, even a single language. So a lot has to do with circumstances. The circumstances can be confusing, but not bilingualism or multilingualism. So bilinguals are less intelligent. Well, not really true. In the US, there tends to be kind of a push on, well, you speak my language, kind of a thing. And I think a lot of countries have that, speak my language. If you're in my country, speak my language. And so therefore, there's also some, thought that, if you don't speak my language, if you don't speak the language, you're less intelligent, that person actually speaks another language. So they do speak, they do think, they are an intelligent being. And this really hits my heart because as a child, I saw my mom, I would go with her, for example, to some of her jobs, and people would treat her differently because she had very few English words, and she would be treated as if she was not intelligent. And my mom, by the way, was a physics professor in Poland, so on a graduate level. So I mean, she was smart. So in recent studies, bilingual children were found to be superior on tests that require symbol manipulation and recognition. And this is recognized in that multilinguals solve linguistic problems based on understanding concepts between forms and meaning. And so being just metalinguistic, the awareness and nonverbal problems that require participants to ignore misleading information, that multilingual kids are able to, or participants are able to do better. In bilingual people or children, brain does change in structure and in form, making it even more plastic. So if you learn early on, before teenage years, if you learn pretty fluently more than one language, so bilingual or multilingual, your brain will be even more plastic than an average brain of a person who is monolingual, who will also have a very neuroplastic brain. But this has variable consequences though, some good and some challenging. But this doesn't question intelligence. It just causes for some challenges in processing, and we'll be talking about that. So verbal skills of bilinguals in each language are generally weaker than those for monolingual speakers of each language. So my language skills in English and in Polish and in French, I speak those 3 languages, are weaker than someone who only speaks English, because all of their attention goes to that, and that's what they've been exposed to. On the other hand, my brain handles 3 languages, and I just will never be as fluent in English than someone who has been born here and only learned English as their main language. And then the retrieving of language in multilingual individuals is thought to be just basically more effortful and time-taking, making it common for them to have slower speech production, especially if under stress. And sometimes you might notice that I kind of pause. And often that's because I have like a little brain, my brain needs a little break because it needs to find like its connection, because there's so many different connections that have been made and that are all on at once. And we'll discuss this because all of our languages are on at the same time. So, and it's not that that's what's going on and I can actually perceive that in my brain of what I'm thinking, but sometimes slips can happen and I can slip out with like a Polish word or a French word, and we will discuss that too. But anyway, back to the topic is that it just is more effortful to get some words out for people who are multilingual. So multilingual individuals of all ages demonstrate better executive control. The set of cognitive skills based on the limited cognitive resources for such functions as inhibition, switching attention, and working memory. This supports activities such as high-level thought and multitasking and sustained attention. So this is very interesting. So let's talk about the brain and how it's organized. A logical possibility would be that languages would have like different spots and would be uniquely accessed in response to context. So like right now, I would only be accessing this little place in my brain and my cortex or prefrontal cortex or something, and where English lies. Well, that's not true. The evidence shows that all the languages are at the same time interacting, and the interaction between all of the languages just happens in all contexts. And this is called joint activation. So joint activation, and here it is very nicely shown on this slide of both sides of the brain. It is so bilateral. The joint activation creates a greater risk for interference or kind of running into each other, of interference of language error and language errors, which rarely occur, but they do occur, especially for children or if you're in a stressful situation sometimes, or sometimes even in a more relaxed situation, because I tend to, if I'm very relaxed, sometimes even kind of blurt out Polish much more so than when I'm stressed out. When I'm stressed out, I tend to have a loss of words. So it's more difficult for me to articulate better. So those are some kind of interesting things that might be more individual, but it's still language errors do occur because of that all of that activation. Most of the time, that language selection is very accurate. And here, is the medical jargon. So we have the bilateral, frontal areas and prefrontal areas, the caudate, the midline presupplementary area, and the temporal regions. The temporal regions right out there, and Broca's area, maybe you guys know about, which is obviously associated with language acquisition. So I find this topic to be very interesting. The brain regions related to bilingual switching are also critical for general attention and cognitive control. And it helps to explain superior performance on nonverbal conflict tasks in people who are bilingual. So using these cognitive control networks for bilingual language processing reconfigures them for different purposes. So that plasticity occurs in the new purpose, providing that part of like a part of explanation for behavioral patterns and differences between monolinguals and bilinguals that are found on these nonverbal conflict tasks. All of this represents, again, that neuroplasticity that I've been talking about, and how it changes with response to language experience, as long as it is consistent and plentiful. So that's the environment is very, very important. So again, a myth, reducing to one child would somehow make a child more successful, whatever you may, I'm not sure what that means. Anyway, sorry, I got a little distracted. Okay, so success, whatever you describe success to be, whether it is social or scholastic. So reducing to one language may cause other difficulties, especially seen at home as not fitting in and not getting along with parents or siblings because the language skills are going down and not associating well with other family members. And it really causes a lot of social and emotional stress for the child. So there's obviously no evidence that children reduced to one language do any better. And actually, it seems like the opposite is true. So let's not reduce. So more on research findings here. Bilingual speakers have poorer speech perception for their second language in noisy situations. So those listeners who speak multiple languages will do similarly, or perform, like at school, will perform similarly to monolinguals, but the performance will definitely significantly decline if it's noisy. So it's very important that our classrooms are as quiet as possible. Those testing environments and things like that, high levels of noise just negatively affects speech perception, reading, spelling ability, classroom attention, concentration, and educational achievement for bilingual children, more so than monolinguals. I think it also affects monolinguals, but much more so bilingual or multilingual children. And so since 1 out of 5 of our kids in school will have a home language other than English, this is very important, especially when evaluating kids for learning disabilities or ADHD. And we see that so much right now in the medical field, in the psych field. You guys probably see this a lot or asked about it at schools. And we really need to kind of get together and know the details about the child, know if there is a second language at home, because that will impact the possible diagnosis or lack thereof. So we're just remembering that assumptions are dangerous. Learning disabilities and ADHD do not occur in any higher rate in multilingual individuals. And it's very important to rule out learning disorder in both languages. If there's going to be a learning disorder, it's going to be in both languages, in the same way, to the same degree. And appropriate ADHD evaluations need to be conducted. And this can definitely be a conundrum, especially when you're looking for dyslexia, for example. How do you exactly test if somebody wanted to test me in English and in Polish and maybe even in French to see if I have dyslexia? Because I would have to have the same kind of, be making the same kind of mistakes and having the same kind of troubles in all of those languages. But it needs to happen if you want to have an accurate and appropriate diagnosis. So we do know that multilingual individuals may have more difficulty in articulation or language recruitment in loud situations. So teachers can often notice that at first and send the child for an evaluation for either ADHD or learning disabilities. And again, we really need to focus and not overdiagnose and also not underdiagnose, and just do it appropriately. Now, this really hits me, as you can see, because I've been talking about it for so long, because I was definitely told in high school, I came here when I was 11. In high school, I was told that I must translate when I read and translate when I talk to someone else. And in the back of my mind, I was thinking to myself, like, I'm just sitting here translating to Polish in my mind because I can do it so fast. No, I do not translate in my head. And even as far as my medical education, because my brain accesses both sides of my brain, and I get a little bit nervous, and then I block and slow down with my speech. When I found myself in these situations in hospitals surrounded by other doctors and the families and so on, I had difficulty articulating the diagnosis, the plan, the team, and all of this stuff. And that actually caused trouble for me, because at 30 some years old, I was 20, still in my 20s then, but in my 20s there, I was being asked to take a learning disability test, literally, and an ADHD evaluation. And I said, heck no. And actually, I talked about this at the end of my training to all of those attendings. I was a little passive aggressive there. About this fact that, by the way, I'm multilingual. I think a little bit differently. The way I write is a little bit differently. But from all my notes and everything that you've learned about me, I know what's going on. I can prove to you that I am intelligent and I do know the answer. It's just that I'm having a difficult time recruiting my language skills. So. I don't know. So it can go on for a long time. So I'm going to take a little bit of a break here, and this is super entertaining.
Tämän tekeleen päällä mä tasapainottelin tämän videon ajan. Siinä on yrttiteetä, teetä ja 2 ruisleipää. Moi. Jomala Telleilyllä kantoraami Josmerinille kaimeretuksella Mattesolimi evakuoinnissa. Alltså det är ju man sortar eller man handlar ju. Filen man råd ostaglig förkämpare med de skimat trupa malla pluva som fan. Dessa fjortare plådar oss mot en boten och mas hemma. Kas olet maseksimas kuska juurel. Ma ütlesin kataseksimies on karvakormakkaral. Iljas karjuska kadrupailiblakavesnäsnjuru. Minä karal karvokalal ja diskimirin sambuode. Bonsoir. J'inquiète le boulet son savoie de 80. Che le buone oiseau jaschi monard je le podimon. Mangiorno pratiso la viretto putta pesca madra solla. Portugesiski formaggioisredet saio al meriento. Gramma de haudaffa duro ki sancere ju paderasame. I'd say I kill it in my bones. Something's in it. It's like a miraculously mobilizing felt tip pen, like a ordinary quiescence of a marinating florero. Chimisicha nataturu yokimas. Yokittura basanchito yuskidimatoska. Masakituru yokimikkte. La maniero que solo toda mierda, que tondo quise el solo un lugar abierta per viva con todo conmigo pueses. A huevo, cabrón. Yeah, I mean, Trevor misgendered appearing like Monin Fair. Follow me, like a pending French at Bologna value precisely. Hello? Dapachi dima. Padep milkar babaji pani midega adiyamal magar jaunga. Vidiga miligi mi bariba. مقلوصة الواحد على الحباب ما يعرق التحدي من نفس اللي اشتقت لي عرفهم مرقلاص أنا أدرس اللغة العربية في البيت مش شاشي مريلا سبا سبقتم مش شفتش بس برك براكور كوبس بلا بهل البهات مش شفتش بيش هنتا دابو البقتين لا توي ما تاي چنگ بكتا دابو بني بانگه.
All right, I hope nobody found that insulting or anything like that. She was just so good at the accents. I wish I was so good. Obviously, she was not making any sense in probably any of those languages. But definitely not English or British. I didn't understand what the heck she was talking about, but she sure sounded like she was speaking it. So good for entertainment. Okay, so milestones, oh my gosh, those are like ingrained in every cell of my body. And I'm sure you guys also had to know these. And the point of me having some of these slides in here is just how many milestones there are and how long they happen through. So you develop your language through time, and errors can happen throughout this time. So here, as a baby, cute baby, making sounds, vocalizing certain PBM sounds, and then, moving on and being more, using gestures to up and wanting to kind of communicate with that in that way. And then as kids get older, 1 to 2 years old, they will start having more words and combining phrases. And I definitely had a lot of patients or families that were bilingual in Oregon, a lot of Spanish-speaking families actually, and they came in concerned that when they were filling out the paperwork and it said, well, does your child have 50 words by now? Da, 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 da. And they would literally count and they would say, no, oh my gosh, my child's delayed. What's wrong? And I say, whoa, hold on a second. What language are you talking about? Okay, you're talking about Spanish. Now, does your child have exposure to English? And does your child have any words in English? Because they count. So they count, and everything was okay because the child was exposed somehow, television or other people, coming inside the house and talking. And kids are sponges. They will hear a word once and they will grab it, and that's it. It stays. So that needs to be understood by the clinician. And here we go, language, keep on learning those speech milestones when they're 3 and 4 and go on with the more difficult sounds. Oh, excuse me. And the point is that all the way through the age of 6 and beyond, the kids can still make errors, language errors, and they don't need speech therapy. A lot of parents did come to me early at 4 or 5 and 6, they were even sent from schools and said, oh, you need, your child needs speech therapy. But then we would look at these very specialized charts, and we see here there are certain letters that are just harder. R, L, Z, the TH sound. Oh my God, the TH sound for a Polish person, first of all, is like impossible, like 30. My mom could never say that. My dad still can't say that. For me, when I was learning, oh my gosh, I don't know why, but I couldn't say turtle for like the longest time. So, and I remember my sister was studying political science, and I was in high school, and people would ask me, so what is she studying in college? And I could not say political. So I had to practice at home. So there's, but that's putting in that different language, into the mix. But my point here is that for a long time, all the way up to, past age 6, there can still be errors made, even if you're just learning one language, because these slides are obviously for speech milestones for a child that is learning one language. So it's very important to just remember that that's even true for one language. And so it must be even more true for more than that. And so, and then, just remembering that, it keeps on happening, the language milestones. So there's different kind of languages: receptive language, expressive language. So understanding and comprehension of language happens first. And in this order here, the words, concepts, questions, directions, stories. And then there's the expressive nonverbal language. Eye contact happens first, the baby reaching for things. Oh, just thinking about babies, I miss them. Pulling, and then pointing and gesturing. Pointing, by the way, is a very, very important developmental milestone. I was once taught by a very, very trusted physician and mentor that at 1 year of age, the most important question you can ask during a visit is, does your child point to what he or she wants, or to what they notice or want you to notice? Because if that question is answered as a no, it is 99.9% a delay. There is going to be something wrong, and most likely it will lead to autism. That is the biggest link that they found. So I always remember pointing and 1. And I always call this a dangerous finger too, because my nephew always does this to me and I go, no. Okay, so anyway, then we got the verbal skills with the vowels that come in first, then the consonants, babbling, words, word combinations, sentences, and stories again. So there is different types of bilingualism or multilingualism, or how languages can be learned. So either simultaneously, so learning 2 or more languages at the same time before the age of 3, or sequential, which is learning a language after learning one language first, and then at the age of 3 being introduced to a second language. And so we'll talk about that. So in simultaneous language, what we look at when we see a child is, just as I kind of described with that parent that was worried about how many words the child has, you combine the languages. So reaching milestones is very important to know what language is spoken at home, and then the fact that the child is also exposed to a second language, and that they are developing 2 languages at the same time. For example, my nephew has had that situation, as his father is only English speaking, and mother, my sister, is English and Polish speaking. And then our family, my mom and my dad, are a big influence, and we speak Polish to him. So he learned from being a baby both of those languages because his father only got the English. So there was a lot of English in the evenings when they got home, but they were taken care of by my mom or by my dad. He was taken care of by them, and he got Polish there. So he got introduced to both of those languages at the same time. So going to the pediatrician definitely had to take that into consideration. And delay would be it's just like any other evaluation for a delay. You just have to count or look at the fact that the child speaks and understands 2 languages. So here we go. The sequential acquisition is very interesting. So first, you get your first language, normal milestones. If you get abnormal milestones, then it's just that 1 language. And then 3 years of age, you get introduced the second language, and it kind of comes in phases, the way that the child learns it. And we'll talk about these phases that are highlighted here in these different periods. The most interesting is, and usually the most worrisome for parents, is the silent period, because kids will go in, for example, start at 3, like my nephew started preschool at 3, and he would just use Polish, but oops, like that's not, the other kids are not going to understand that. And so then there was all of that mixing. Then he kind of started mixing. Then he became shy and didn't want to talk a little bit, and then he started speaking kind of both languages and mixing them up. But this silent period is interesting because it doesn't have to happen, and it can happen for just a few days, or it can happen all the way up to 7 months of not, like, being in, for example, putting the child in school and that child like not talking at all. And it's not a problem unless it's beyond that. Personally, I would already start to get antsy probably at around six months or so, but that's all about being a clinician too, right? It's we get this information from all the research in our books and this kind of talk that, at 7 months it's still okay, but past 7 months it's not. But then again, you just kind of have to listen to your clinical intuition as well for the child. So there are 4 types of bilingual language learners. So again, simultaneous learner from the majority language group. So learning kind of a second language. So being in the US, my majority language is the English. The second language would be what the family brings in. In my case, would be like Polish for my nephew. Simultaneous language from the minority language group. Is sequential learner from majority and sequential learner from minority. Anyway, the biggest things are quality of language, quantity, variety of context, different, play versus something more serious, and at the store and at the park and at somebody's house, opportunities for language use, and the environment and the attitude and the motivation of the child. The motivation of the child will come from the attitude and the environment that they are in. If the family thinks it is important to speak Polish, then my nephew will speak Polish. If we think that it's not, he's not going to keep that language, and we're going to talk about that. So language as a choice. Well, bilinguals don't usually, are not pre-selected for some kind of talent or interest in linguistics or anything other. They just differ from monolinguals because of the certain way that they generally do not choose bilingualism rather than just the circumstances that happen. So circumstances are very important. So of the family, so place of birth, immigration, like for me, and it's history simply requires that they learn more than one language. And so it's not that bilinguals are usually some kind of special kids that just pick up like a second language. So now an idea of a sensitive period. So overall, this theory by Eric Lenenberg in 1967, this really big book of biological foundations of language, it didn't hold or stand the test of time, but it has provided the foundations of thought of a sensitive period for a language learning. And so when this was tested through time, what we've learned so far is that anyone at any age, be it very young to very old, can learn any language rather fluently. But at about puberty, when the brain is starting to become quote unquote kind of less plastic, it's not less neuroplastic, it's still neuroplastic, but when you're a baby, it's just like it grows like exponentially. And then the exponential growth kind of slows down, and it's kind of maybe a little bit just kind of a less steep of a curve of learning of that neuroplasticity. And so the development of acquiring perfection in phonology and grammar definitely suffers. So for example, my dad gets always very frustrated that he has an accent, and sometimes he just doesn't put the words together correctly. And I always remember my mom waving at me saying, have a fun. And that's like our family thing now. And have a fun, bye, have a fun. But anyway, little joke. So the critical period, again, motivation plays a key role no matter what age and language acquisition. So an older individual definitely can learn that language, even if not just like perfect as they want to, but you can pretty much learn almost perfectly. This is particularly related to language dominance and the rotation of language. So mostly that dominant language, the L1, and the motivation in keeping that language fluent and spoken, and then passed on to further generations. That's where that motivation lies. And the environment, again, is the key factor of utmost importance. So keeping it in the family important, that this is important, we're going to speak this language, and therefore speaking that language at home, introducing peers. Peers are very important in having peers that speak that language is exponentially higher a chance of a child continuing and retaining their language skills into their teen and then adult years, and then go on and then on and on. So simultaneous bilingualism, multilingualism, again, early communicative milestones are attained at comparable ages for monolinguals and bilinguals when we learn languages at the same time. Grammar and phonology evolves in similar fashion for both of the languages at the same times. Errors are normal. Children can learn more than 2 languages at the same time with sufficient exposure to all of those languages again. And you can determine a dominant language. So they will, develop simultaneously and evolve in similar fashions, but there will be a dominant language. And the dominant language will have longer sentences, more advanced grammatical structure, more vocabulary words, fewer pauses and hesitations, and then just greater volubility. And then sequential language, so one after the other, the use of the first language in a second language environment. So use of my nephew use of Polish in this English environment. There's that telegraphic phase, the nonverbal period that we actually already talked about that can be normal for up to 7 months. And then you start the production of the L2, the second language, and have that interlanguage. So there's two types of proficiency that then happens when that second language is introduced, which first, obviously, I think, as most languages would be introduced like at school, is communication skills, or well, maybe not at schools. I'm sorry, I think I have that wrong, because I think, you know, kind of the grammar and stuff are really focused on in school. But if you were to like pluck a child out and put them in a different country, they would first pick up on basic interpersonal communication, trying to communicate with peers and with the environment around them. And then the cognitive academic language proficiency would start to kind of catch up and happen. And that will take a little bit longer, just because it's more difficult. Just as if you only learn one language, it's that's what takes a long time to learning all those grammatical rules and stuff. I actually never learned the English grammatical rules. I kind of learned things as I went, and there's a lot of things missing up here when I form a sentence. It's kind of more based on how I learned it intuitively, and the grade that I was in, because I was almost 12, so I was in junior high school, and I was way past like learning, you know, what's a noun, what's a verb. I kind of had to like figure that out. So you know, you miss it, you miss it. I guess I could learn it now, but I really don't want to. So there's the motivation factor. Bilingual children who can definitely lose that first language that they are taught if they are in that majority language world, and the L1 is the minority language, and they are at risk. But the consequences are bad: eroding family relationships, poor self-esteem, less cultural identity, compromised relationships at school and at home, and compromised school performance. And the contributing factors is the age of introduction of L2, of the second, the majority language. So the later, the better, actually. So if you introduce it really early on, the child might actually adapt to that and identify with that second language more than the first language. So the later, the better, actually. And the child will still learn that second language very, very, very well. They will be fluent, no issue. Rank in the family: if they have a sibling that's older and also speaking that language, and you know it's valued, they will want to speak that language. But if they don't, then they will not want to speak that language. Also, if there's a baby at home and an older child that's out already, you know, in school learning English, and they come home and start speaking more English than the home language, that will impact that little baby or toddler that's there, and what they're exposed to in language, and therefore how they're learning that language. So the and here's the interaction with the L1 peers. So it's really, really important to introduce children who speak the same language that is the minority language, in order to keep that first language. And then the language profile of the parents: if both of the parents speak that minority language, it's obviously going to be much easier to keep that language, versus like a situation for my nephew where not both parents speak that minority language. And then again, as we talked about, environmental, that perception of the importance of that first language. And code mixing and language switching definitely happens. And it can happen inter-utterance or intra-utterance are the terms for that. And that means, so inter-utterance would be one sentence in one language, another in another language. I have here, come to the table, kolacja jest już gotowa. And that means come to the table, the dinner is ready. So that can happen, and it can just happen naturally, or more of a mixing of some of the sentences in one language or another. And I have example here that says, I'm going shopping, żeby kupić sobie buty. So it's one sentence is, I'm going shopping to buy myself some shoes. And, you know, this can happen naturally or kind of even on purpose. When I speak to my sister, we do this all the time. And I would say it's the intra-utterance that we do more so, because I feel that with those connections of the brain centers and the languages at the same time, when I speak to her, whatever word comes to me more easily, I will say it in that language. So probably whatever I learned first. So if I start speaking to her in Polish, it is the more difficult words that I probably learned in a more advanced, like high school or college, that I will place into the conversation in English. Or if I was trying to explain something medical, this would be very difficult for me to do in Polish, although I probably could, and I have, but sometimes it does take me looking things up and actually learning more Polish. So that's really good. I actually enjoy that. But yes, whatever we reach for first, and sometimes we sound silly, but it's a fun thing to do. It's an easier way to speak than having a lot of which I tend to do. See, I just did it. So the language switching studies on bilingualism are just abundant about, but the cognitive processes and neural foundation of switching, it didn't really get a whole lot of attention until neuroimaging, and it plays a big role in studies now, where in the past, patients with lesions were studied. So if somebody had a brain lesion, they were studied. So that really didn't give us a whole lot of value. Now with neuroimaging, we can see that it seems to be, the language switching seems to be subserved by a large-scale cortico-subcortical network with an executive system, which is the prefrontal cortex, the anterior cingulum, and the caudate nucleus. And those things control a more dedicated language subcircuit, which involves the posterior temporal areas and these other areas here. I don't want to overwhelm with any kind of medical jargon unless you want it. But the importance is that, you know, there's just a lot of studies on that now, and these specific brain locations are found to play a part in language switching. Bilingual kids and language disorders. So learning two languages or more at a young age will not cause a delay or disorder. If a true delay does exist, it will happen in both languages. And I sort of mentioned that before. And the types of error and the severity noted will be similar to monolingual peers with language disorders. So red flags, I mean, these are just red flags, and in any kiddo, whether they're speaking only one language. I'm sorry, I'm getting a little dry mouth. Getting a little, so whether they're speaking one language or multiple languages, you know, if they don't respond to their name, if they don't point at the age of 1, and they don't start combining words, whether it's in multiple languages or one, those are red flags. They're pretty much consistent for any child. And since I have this superpower, I'm going to take there you go. Okay, and I think I'm sure you guys have your own superpowers of different languages out there, or other. So practical considerations, babies and children have the ability to learn a lot of multiple languages, as we've been talking about, so that neuroplasticity remains throughout life and languages will be learned, but maybe not perfectly, but yep, they will. It should not be assumed that a language delay is caused by exposure to more than one language. It should be encouraged and should be encouraged to be sufficient in the amount of language exposure. And children with a language disorder can learn different languages. So they should not be in any way stopped from learning another language. If they have like a dyslexic child, a child with dyslexia, because there's no such thing as a dyslexic child, that's a label, so I'm sorry. But a child with dyslexia can learn another language. That language will also have those errors and will also have that same type of dyslexia, but they can definitely learn that language. So it's inappropriate to recommend to parents to go down to one language, to only have the child speak one language. And there's only very few reasons why you would say, okay, one language only. And that's if there is a brain lesion, a clear brain lesion shown on studies, or an anatomical or physiological change in the brain. So for example, children with severe epilepsy and severe seizure disorders, often the neurologist would recommend only having one language spoken, because that brain is already being overstimulated, is being taxed. So it's very taxing on the brain. So you kind of don't want to add on any more chaos to what's going on, because you're trying to treat the epilepsy so that the child develops as well as possible. And I don't know, depending on experience, kids with epilepsy, they will often have language and speech delays or disorders or just difficulties. And so those centers tend to be very important, and therefore if there is a seizure, it will definitely impact speech. So you don't want to add too much to it. So then, referrals to speech and language pathologists should be made. So as not to, to kind of figure out if a child is not hitting those major communication milestones, but it's important for the speech pathologist to be aware of the of language acquisition. So again, this is like a summary that kids can lose their first language. So let's encourage them to speak that language and the second language. That peer interaction and reading books in that first language is very important. And bilingualism should be really viewed positively and reinforced. And again, learning that sequential takes a little bit more time. There might be that silent period that we talked about that's really clearly written out here that can last for quite a long time. And code mixing, which is absolutely normal, a part of bilingual communication. And kids should not be reprimanded for any of this. And it should be a reflection on, it's just a reflection on their culture and social identity. So again, now this is kind of like a very sensitive chart for me, because, oh my gosh, have I seen my parents who with a big, have a big accent been yelled to as if they are hard of hearing instead of having speaking a second language. You know, if you speak louder, it's not going to make me understand you any better. Change your words so that I can maybe understand the next word that you have. And I saw that as a child, and it really touched me. I was, this is the practical considerations of children of immigrants or immigrant children. My role and my sister's role were often going to places with our parents and being the interpreters, like in the bank and things like that. And those interactions were frustrating and confusing, and it was difficult. It's also difficult to see your parent who you're looking up to, and someone's yelling at them, and not understanding that that's your parents not stupid, and they're being treated as they are stupid. So that impacts the whole family dynamic and the child. So you just slow down for a person who has English as their second language. Use a simple everyday vocabulary, use gestures. I use a lot of gestures. I mean, I would be like walking around this room right now if I could. I'm kind of a little stuck here because I have to press a button on this computer. But I think that's why I love languages, and I speak French too, and I quickly pick up something else. And I've been in situations where I've had patients in the emergency rooms or in my own clinic where there was no interpreter and the phone wasn't working for the interpreting line. And we were gesturing and just trying. Someone was speaking one language, I was speaking another. And then I tried French, and then I tried Polish. And then I was like, and we worked it out. So you can work it out. If I can work it out in a medical situation like that, you can work it out in an everyday situation. And repetition, if not understood, but don't repeat the same words. Just try like a new one. Okay. That's easy, right? Oops, I'm just clicking the wrong thing. Okay, this is the check-in for questions regarding language development, neuroplasticity. And Michelle, if there's questions in the chat, I would love to.
We do have one question so far about the PowerPoint. We had a student that wondered if the PowerPoint would be shared. So that's our first question.
It sure can be, and since this is recorded, it's going to be there, but I can definitely send that out to the appropriate people, and it can be shared if wanted. I'm very happy to.
You can send it right to me and I'll send it out to everybody, no problem.
That's good, yeah.
Yeah. Any other questions? If you have questions, feel free to either unmute yourself or to type the question in the chat. One housekeeping thing, if you're listed as Samsung or iPhone, I need your name for the attendance. Questions in the chat, or feel free to unmute yourself.
Yeah.
Hello, my name is Kimberly
Yes.
Griffin. Can you put my name down for attendance, please? I have an iPhone.
I guess that's not a question.
I don't have a question, but I really enjoyed the webinar.
Thank you. Well, I'm glad.
I just learned so
hope
much
that's
tonight.
good.
I really enjoyed every bit of the webinar. You were great.
Well, we're
Thank
still
you.
going. Don't go anywhere.
I'm not going anywhere. I just wanted to let her know that I was here.
Thank you. Yes, I'm so glad to hear voices, because I feel right now like I'm just talking to myself and yelling at myself. So it's really nice
We have a question, Monica. We do have a question from Leslie.
I'm ready. Yes.
Do you feel sequential or simultaneous is best for a child with a diagnosed language delay?
Oh, very, very nice. Diagnosed. Okay, so simultaneous would be during that first 2 years of life, 3 years, I'm sorry, 3 years of life. So at that time, it wouldn't be diagnosed yet, right? It's just impossible because would it be diagnosed? So it kind of depends on when the diagnosis happens. So therefore, I guess you're already at that, you're kind of hitting a sequential after 3 years of age. So you go with sequential. So it's kind of maybe if someone wants to unmute and explain the question a little bit more, then maybe I can answer it better. Because I'm not sure if that made sense.
Well, I work in early intervention, and
yes. Oh, thank you. Love you guys.
There are a lot of people who recommend to the families that we work with for children who have not been quote unquote diagnosed, but are strongly suspected of having a delay or have a significant language delay.
Okay.
And there are a lot of therapists who continue to recommend working only in one language, which would then lead to a sequential language development. And so I'm just curious as to your thoughts on having a child concentrate on a single language during that time, which would then lead to sequential acquisition of the second language and bilingualism. I have a strong opinion. I'm just asking what yours is.
Well, I feel like that begs the question of whether or not we need to recommend only one language for that family. And I would say no to that. And I would say that the child needs to, obviously, if the therapist speaks only, one language, the majority language, that's the therapy that they're going to get. I think if it's possible to teach the parents of how, if there is a possibility of how to work in their home language at home to help the child, then I think I would recommend that. Because I would never recommend stopping the second language personally, unless there was, a brain lesion. But then again, like I said, like you really have to go with that gut. Because if you're talking about, a severe, because I think you use that word, a severe language delay, and if it's like autism or something like that, then, that's very difficult. I would probably say like, oh, I think it's okay to be exposed to that second language, but I wouldn't focus on it. I would focus on the majority language. Does that make sense as an answer?
Yes, absolutely. Thank you.
And I hope that, I don't know if that's, I kind of wonder what your strong opinion is, if you don't mind sharing, but you don't have to.
No, I work mostly with kids who are hearing impaired or who use sign language as their language.
Yeah.
And so, the visual language is approached a little differently than a second language. So, but so you're speaking more of like Polish speakers or Spanish speakers. And so my opinion for that is, give them, I do both languages. I'm fluent in Spanish, so I can do Spanish, and I do both languages. And then whichever one they do better in, that's the one that we tend to focus on a little bit more during
the dominant one. Yeah. Mm-hmm.
So that's how we work. But with the visual language, it's a little bit different because it is visual. So it's processed in a whole different way, as you know, I'm sure.
Yes, it is. And because of that complexity, because I was thinking about adding that to this talk, and then I would have to take out this next part of the talk, because it would just be like, as you know, it would be like another hour, right, of talking about how the brain develops and how everything develops in a child that's hearing impaired.
Right, and we could go all night with that, I swear.
We could, yeah. It sounds like we're meshing here, like this is like a passion. So thank you so much for your work. Wonderful.
Thank you.
Yeah, and thank you for sharing. Okay, any other questions?
Actually, sorry. Hi, this is
Hi.
Ashley.
Hi,
I actually
Ashley.
kind of had a question piggybacking off of that, and I'm not quite sure. I guess I wanted to know more of your thoughts, but going under the research findings that you found, one of them was that bilingual speakers have poorer speech perception for the second language and noise than do monolinguals. I wonder if that might translate to sign, and noise being maybe a bunch of people are signing in a room. Does that impact then, say, a deaf person who uses ASL? Would that impact then if there is a ton of noise, or if like someone who's like first language is English and second language is ASL, does that affect their speech, like their communication perception if there's like a ton of like visual noise? Or I guess just your thoughts on that.
Very, very interesting question. I bet that our participant prior to this would, prior to your question, would have a better answer than me, because I would say that that's probably different brain centers.
Okay.
And I would, let's ask.
Are you asking me?
Yeah, Dr. Buka.
What do you think?
Well, I can only speak from what I know, and that
Yeah, of course.
With you know, when with sound processing is a whole lot different, especially when you're getting, you know, that auditory processing slowness with the background noise, trying to figure out that figure ground, what you're supposed to be listening for. But with visual, it's basically what you're looking at because it's light reflection. So my guess would be no, that you would not have that kind of interference unless you had a child or an adult who is very visual, was very distractible, like ADHD child who would have difficulty maintaining, or a child with autism who would have difficulty maintaining, you know, contact or visual presence with their own speaker. So my guess would be no, but you know, the auditory processing portion makes sense because if the language is more difficult for you and you don't have a high enough grasp on it, then incoming sounds are going to be more interferent because you can't block them out. But if you are just looking at something, you know, unless you had like an ADHD sort of thing, I would not think that that would be something that would be visual distractions, would be something that would interfere with your signal. It might interfere with your concentration, but not with your signal. That's just a guess though.
Yeah, well, thank you. And it does make sense because I mean, you know, we tend to focus in on kind of, you know, kids do too, on what we're doing. So it's a, you know, if you're using a vision to for gestures and your communication, like you said, I think if you're super distractible by the periphery, then I could see that being a problem. But if you're tuned in, you know, into what you're doing, whether it's a reading, writing, or another person signing to you, I think that it's the attention would stay there. I agree with that guess, but then again, I'm also guessing, you know, kind of like we're trying to do an educated guess here for that. Very interesting question.
Thank you.
Thank you.
Dr. Siedlarz, I did have one more question. First of all,
Yes.
thank you so much for your knowledge and positive energy tonight. I really appreciate it. I just had a specific question about the silent period you mentioned.
Mhm.
A specific age where you typically have seen this in your practice?
Yes, so usually around the age of 3, 4, 5, I would say usually like 4 would be like the mean of a silent period. Because the child at that time really, like, the language just like whoosh, like just like it takes off, like, you know, it takes off at different phases as well, you know, and it does the same thing, but it seems like at 4 there's just so much much more cognitive kind of skill that kind of goes in, and kids are starting to really be very are very creative and they play, you know, they imagine, they have those imaginary friends and all of that, that world kind of comes into, you know, their imaginary world is out here too. And so during that time, if a child is introduced into that second language, the majority language, with only having that first language experience, it's at that time, the child also has much different kind of social experiences and skill and emotions that are starting to develop. And that's what pushes that silent period a little bit more, because they become a little bit like, I'm different a little bit, kind of like, wait, hold on, something's like not matching up. Versus the younger kids, they don't connect the dots. The really older kids, they already know. Like if it was like 7 or something, they know. Like when I was 12, that's like, you know, way out there, right? 12, I knew. I came to the US, I was like, and it's not that I had a silent period, but I definitely didn't speak to people. They spoke to me. I didn't speak back. I understood them. After a while, I understood them. My language skill was already developing. And sometimes mean things would be said to me. Sometimes good things would be said to me, and I didn't respond. So I did kind of had a silent period in certain circumstances. But so as cognitive skill increases, I think that's where you see more silent period.
Thank you so much.
Does that make sense?
Absolutely. Thank you.
Okay. Well, anybody else? Okay. And anybody else, Michelle, on the chat?
We do have let me see. I think focusing on the dominant, Aisha Mason has mentioned this. I think focusing on the dominant language would be better for a child diagnosed with a language delay because they are more fluent with their primary language. As the child's ability to speak his or her primary language increases in growth, they will be able to take the steps to learn a secondary. I believe this is how bilingual children teach their parents who are not bilingual.
Ah, that's a good point.
We have another question also from Elena, and that question is, what would be your best advice for a caregiver whose child's first language is Spanish? The caregiver does not want their child to receive services in their first language.
Can you read that again? So the child gets, or if whoever wrote that, if they can.
Elena, do you want to unmute yourself?
Yeah, so let's suppose that a child only speaks Spanish, right? But the child is enrolled in school, or or receive, for example, early intervention services for speech. But the caregiver doesn't want the child to receive those services in the Spanish language because they want the dominant language to be present. So what would be the best advice for the parent in that case?
Let me rephrase that for myself. So the child only speaks Spanish and has been referred to services for some reason, but the parent does not want it to be in Spanish, but they want it to be in English.
Right, in the dominant group, and in the dominant language of English. Like, what would be your best advice for the parent? Like, knowing that for assessment, how we assess the child when we'll be assessing him in a language that he's not dominant in.
I think you answered your own question because that would be the first thing, is like, well, it's going to be really hard to give you services if the child will not understand anything that I'm saying. This is going to get worse. If there's a delay or any kind of issue in that primary language, and so far we've only have primary language, and something was caught very early on by the pediatrician, and they were sent to services, the services should be in that language, definitely. And so it would be just explaining what you just explained to me. You know, it's like, well, you know, and I guess, and asking the parent why they would want that. Because, and I could understand it kind of like, well, because we want our child to be, you know, successful in English, you know, because this is, we live in the US and this is what what is the expectation, etc. But they would need to understand that, you know, what we're talking about here now, that it doesn't matter, that your child will be successful, they will learn English just as well as Spanish, and this will translate, the therapy will translate into the second language.
Thank you.
Do we have some other questions? Feel free to unmute yourself.
Okay, if not, then I'm going to go on, and we're gonna switch a tad of gears. Of course, I have to have, you know, something entertaining here for you. So,
Taster's choice moment between guys. This is really nice. You got a thing for swans? Is this like a fetish? It's something like maybe we need to devote some time to.
Thought about what you said to me the other day about my painting. Stayed up half the night thinking about it. Something occurred to me. Fell into a deep, peaceful sleep, and haven't thought about you since. You know what occurred to me?
No.
You're just a kid. You don't have the faintest idea what you're talking about.
Why, thank you.
It's all right. You've never been out of Boston.
Nope.
So if I asked you about art, you'd probably give me the skinny on every art book ever written. Michelangelo. Know a lot about him. Life's work, political aspirations, him and the Pope, sexual orientation, the whole works, right? I bet you can't tell me what it smells like in the Sistine Chapel. You've never actually stood there and looked up at that beautiful ceiling. Seen that. If I ask you about women, you'd probably give me a service of your personal favorites. You may have even been laid a few times. But you can't tell me what it feels like to wake up next to a woman and feel truly happy. You're a tough kid. I ask you about war, you'd probably throw Shakespeare at me, right? Once more into the breach, dear friends. But you've never been near one. You've never held your best friend's head in your lap and watch him gasp his last breath looking to you for help. I ask you about love, you'd probably quote me a sonnet. But you've never looked at a woman and been totally vulnerable. Known someone that could level you with her eyes. Feeling like God put an angel on earth just for you. Who could rescue you from the depths of hell. And you wouldn't know what it's like to be her angel. To have that love for her, be there forever. Through anything. Through cancer. And you would know about sitting up in a hospital room for 2 months, holding her hand. Because the doctors could see in your eyes that the terms visiting hours don't apply to you. You don't know about real loss. Because that only occurs when you love something more than you love yourself. I doubt you've ever dared to love anybody that much. I look at you, I don't see an intelligent, confident man. I see a cocky, scared, shitless kid. But you're a genius, Will. No one denies that. No one could possibly understand the depths of you. But you presume to know everything about me because you saw a painting of mine. You ripped my fucking life apart. You're an orphan, right? Do you think I know the first thing about how hard your life has been? How you feel, who you are? Because I read Oliver Twist. Does that encapsulate you? Personally, I don't give a shit about all that because you know what? I can't learn anything from you. I can't read in some fucking book. Unless you want to talk about you, who you are. And I'm fascinated. I'm in. But you don't want to do that, do you, sport? You're terrified of what you might say. Your move, Chief.
Gotta love Good Will Hunting. And the point of me putting that in there is story, right? All of our patients, clients, students, they're all individuals. We're all individuals. We all have our unique story. And it's so important to listen to that story and tend to work together in helping that special individual. And now we're moving on to the sensory processing sensitivity trait. It's a genetic trait. We are all very genetically unique. This is something that really touches me because I learned about this a few years back, and it changed my life, and it changed how I live every day. And you will learn why about this. It's a little bit more known in the West Coast, I believe. I've noticed as I came to the Midwest. But a lot of people with this sensitivity call themselves a highly sensitive person, an HSP, or highly sensitive child, HSC. And it's a touchy subject with that title. Personally, I personally don't like that. I like to use the medical term, which is sensory processing sensitivity, because whenever it's really hard to explain to someone who doesn't have this trait what being highly sensitive is, and because of that word sensitive has, I feel, is kind of like a taboo, like, don't be so sensitive. I hear that all the time still. Stop being so sensitive. My dad tells me that all the time. My sister tells me that all the time. And the thing is, it's that's not what it is. It's not that I'm being overly like crying and touchy and things like that. So we're going to talk about the sensory processing sensitivity and what it's all about. And hopefully you'll figure out why it's important. So Dr. Elaine Aron, who I was lucky to meet on one of my quests of finding out more about this trait a few years back, identified and named this trait in 1991. Of course, it was known about before, like, that there were people that were more kind of in tune into things, because that's what it's all about. But she really named it. She said HSB, she said SBS, and kind of put it into popular use and put it into a really great book, The Highly Sensitive Person, from which I got, I learned a lot, and then went on to finding out more research and going on a lot of training and retreats to really know if this is real. So it is not a disorder or a condition. It is an innate temperamental trait, and it's found in about 20% of the population, and about equal numbers in males and females. So it is definitely founded on solid research, which is a lot of fMRI studies and genetic studies. So there's an actual gene that has been identified. And the research is only increasing. So since 1991, it's been almost 30 years, the research has been supportive and increasing in this area of this gene and this temperament trait. So what is it? It's not introversion, because at first Dr. Aaron thought that she was studying introversion. And as she was asking some specific questions, which if you go, if you just Google her or look at this book, there's a bunch of questions that she started asking people about what they noticed and what kind of people they were. And she thought it was a lot of introverted individuals. And it seems that about 30% of these individuals with the SPS traits are actually extroverts, and I'm one of them. And it actually, being an extroverted person with this trait is actually quite challenging. So, and you'll find out more about that. Research has been done in adults, children, and many species of animals. And it points to the trait being an advantage and needed for survival of the species. So this is not a trait that's going away. You know, like because it's like 20% and 80%. And it's not that like the 20% is better or worse than the 80%. It's just that that's how you know, I guess if you think about the theory of survival, you know, more like animalistic survival. This is a trait that needs to remain in the species in a you know, minority amount, but needs to be there in order for the species to thrive and keep on surviving, to kind of add to the mix in some way, as we are all different. So again, it shows a highly sensitive nervous system, and the trait has positives and negatives. And at its core, is what I try to say at the beginning, is noticing things more intensely. That's the best way that I can describe that. The essence of the trait. So Dr. Aaron has this acronym that she does: depth of processing, overstimulation, strong emotions and empathy, and sensitivity to subtleties. And some of these just kind of one leads to the other, as we're going to look at all of them. So here, depth of processing, this is like the basis of this trait. Reflecting on information just very deeply and elaborately, more so than others would. It can't be seen, but it is the most basic of the traits. Often it can lead to mislabeling people, mislabeling children and adults who, for example, prefer to be on the outside first to observe before they go in and start play. You know, and they are often called shy or afraid. They're being pushed, especially I think about children, because I work with kids. So a lot of assumptions are being made, and the child is being forced to do things that perhaps they're not quite ready to do yet, and not because they're shy or not because they're afraid, but because they have this trait. So many may even put the children on an autistic spectrum scale of that, like highly functioning autism, because the child is odd, because they're just kind of on the outside first, and so might be a little bit, it looks like social awkwardness. We cannot assume autism simply because of a difference. And we also cannot assume SPS to avoid a diagnosis either. So I really want to make that clear too, that I am in no way saying that we should not investigate and diagnose, because it's very important to do investigations well. And so what's possible? You can have the trait, you can have a disorder, you can have a trait and a disorder. So a child needs to be evaluated by someone that knows about this trait. And I think that already answers the question of why am I talking about this? Because of how important it is for all of us in the medical field, in the social field, psychological field, in education. We need to be aware of this in order to be able to evaluate children appropriately.
We have a question.
Okay.
Shannon, do you want to say your question?
Go ahead.
Oh, sure, I can say it. Hold on. Hopefully a dog doesn't bark or anything. I was just wondering if you knew of a correlation between being, this would be more for adults, a highly sensitive person and borderline personality disorder. Not saying that everyone who's highly sensitive would have it, but is there a correlation, if you know?
No, there would not be a correlation for that, because highly sensitive, and as I go through this topic, people with SPS don't have the qualities of borderline. Let me go ahead and finish and go through this topic. And then at the end, maybe we can kind of roll back to this question and see if it makes more sense. Is that okay?
Oh, of course.
Okay. So I'll stop obviously at the end and I'll answer all of your questions. I'll be happy to. Okay, so the depth of processing to avoid error, we don't want to make mistakes. Research has been very important, especially in the last 20 to 30 years, as I said, and this, this trait has been popularized, and it has just been found in human brains, and it's been studied in psychology and studied in the physiology of the brains. There's a lot of those fMRI studies, and their finding is that increased engagement of the brain in the areas of social awareness and processing. And when they do the fMRI studies, they find people integrating with another person more, and making more emotional meaning. And that's where those emotions kind of come from, and empathy. The studies of the amygdala are very interesting in people with SPS, with the SPS trait versus people who do not have the SPS trait. In the amygdala produces, that fearful and anxious response in us. And in the two groups, there is no difference. So people with SPS do not have a tendency to be more on edge or fearful. So they are not observing because they're afraid. So that, I think that was, the basis for the study of the amygdala. And so not all depth of processing is conscious. A lot of it is, it happens just, that's why we say sleep on it. And then in the morning you come up with like a new idea or how to fix a problem if you had a problem. It's much like intuition. And it can happen basically at all times to any individual, 100% of the individuals, right? And for someone with the trait, it basically happens at all times with much more depth, which much more detail. And this is extremely taxing on the system as it is being done so deeply. So people become overstimulated much more easily. So if you go to a party and you have the trait, you notice so much more. The music affects you more. It seems like, all the senses are just kind of picking up. And it's not that there's a disorder It's just that you're picking up on them. You're picking up on the subtleties of the environment, of how people are interacting and feeling, and so on and so forth. And then getting home, people are often exhausted and they crash. And they're very overstimulated when another person might like want to go to another party or stay up and watch some movies or something like that. So I definitely had that problem of like, no, I don't want to do that. So overstimulation. So this is what people really notice. Others who do not have the trait and those who do have the trait. And it is kind of the most frustrating part for both. The threshold is much lower for individuals with SBS, and with the processing much deeper for that. So the threshold is much lower for overstimulation. So then you need a balance of when to be out in the world and when to kind of take yourself back in and spend time with yourself, to calm, to self-care. And therein lies the difficulty of achieving balance, because that is, I mean, I think every person struggles with balance of self-care and, and work and school and children and all the things that life asks of us. So this, I would find the biggest disadvantage of the trait. Sensitive people are often, very curious and creative, just like anyone could be, and want to offer the world what they can, but they need downtime, and often they need much more downtime than the average person in that 80% group. And that's often misunderstood. And also kind of like, what's that person, they're all about themselves kind of, but it's really important to understand for that individual, because then they can plan for more balance. For example, I know this week has been very exciting for me. There has been some really great things going on with my practice, and this talk is really exciting for me. I'm really excited, like my body had a lot of like hormones and neurotransmitters probably had up and down and all around. And I'm really happy to be talking to you and about these very important things to me. And I know that I am going to crash after. And the thing is, it's not that I'm going to crash, it's that I need to self-care, right? I need to find a balance. Unfortunately, that's really difficult. And I'm still discovering what would be a good, kind of balance when your day is so busy on and off. You're living in this culture that is busy. And we have so much going on, especially now with the pandemic, with society, politics, everything, right? And it's kind of like you think about all of that in the back of your mind, and even any person, the 80%, the 20% are doing that. And then if you're in that 20%, you're doing that overtime, plus you're doing overtime with everything else. And it's like, okay, now I really need a breath because I'm going to drown. And that happens. If you don't care for the trait, there will be consequences, meltdowns and breakdowns for different, in children and in adults, the consequences are different. I definitely, at a certain point, after a few years of practice, I would be like the last person that should probably even go into medical practice. I don't know how I survived, but I was very different from my classmates throughout, and I never knew why. How come, my friend Neha could go through her 32-hour shift and then want to go to dinner, where I was like, no way, I'm going to sleep. Like, this is crazy. Are you serious? Like, so much has happened and I didn't even process. I just needed to sleep, and then the processing you don't even have time to process. So then years and years went by as I kind of kept going as the Energizer Bunny, with just trying to get sleep and and also being frustrated with myself that I cannot join social activities often because I feel so exhausted. So then I felt, what's wrong with me? There must be something wrong with me. Is it physical? Is it psychological? You know, you pathologize, and you are pathologized. I was pathologized as an anxious child, as an anxious person. I pathologized myself. I was on medication. I am on medication, you know, for anxiety. And then I learned, you know, that actually I am just really, really overwhelmed, and my system is taxed and maxed out. And I actually left the medical practice after years of practicing because I couldn't manage. And that's why I'm here doing what I want to do, how I want to do it, in the way that I want to do it. And it's much easier for me to balance. And actually this is an important point, because a lot of people with an SPS trait who do a lot of, who do take the time to be introspective, because they tend to be very introspective, but take extra time to be introspective, they tend to go on off on their own. They tend to open their own businesses and so on and so forth.
We have a raised hand here from Ashley. Ashley, do you want to ask your question?
Sounds important.
No, sorry, that I forgot to actually take that off from the last one, so I'll take that
one
down.
Okay.
Sorry.
I actually have a question, if it would be all right to ask. I had a question about somebody with an SPS. Are they more prone to having anxiety disorders or panic disorders?
No, absolutely not. And as I go on, you will understand why. But absolutely, but no. But there's a but. So let me go on, and you will. And if you don't see the answer, ask me again at the end, okay? Because I think you'll see the answer. Okay. Okay. So a child can be seen with this trait. A child can be seen as you know, highly negative, emotional, and difficult temperament. They tend to have a lot of meltdowns and tantrums. And it's very important that the parent knows the child well. They act in a very different role for a child who is highly sensitive and who can get overstimulated much more quickly than another child. They tend to need to be an orchestrator of the environment for the child and the experiences, to alter the reactivity and the experience of the child, so that they don't get so overwhelmed to the point of meltdowns and tantrums as much as possible. If they are willing to sit down and look at their child and listen and hear and see if this is actually, you know, maybe a sensitive child, or if there is a problem with discipline, because of course we have to talk about that too. So the trait makes for a highly reactive child and a reactive person in general, and thus they're very susceptible to his or her environment more than others. And this is where that question about anxiety does come in. So what this means is a positive environment will impact the child with this trait more positively and more so than one without. So they're more likely to thrive, create, and be productive and be a real impact in society. And then a person with this trait, a child with this trait in a negative environment where they don't get that attention or their needs met as babies, as children, that will impact them much more so than the 80%. And then they are furthermore prone for anxiety, depression, and other, you know, consequences in the future. So are they, you know, more likely? Only if the environment supports that for the future, but not because they are born necessarily with a chemical imbalance, because this is what we're taught a lot now, right? That it's a chemical imbalance, you need a medication, here you go. There's a lot more to it than that, you know? So there is definitely a possibility of that, but there's no way we can measure serotonin levels in our brain where serotonin is serotonin or epinephrine is prescribed for depression, anxiety, but people don't get tested, like their levels, they don't get tested because you can't, right? Or like how responsive the brain is to how much you have. It would be wonderful if we could, because then that would make prescribing so much easier, but we can't. Anyway, I think I went on a tangent there. Emotions and empathy, so that third characteristics. So often emotional, the word emotional, being emotional, is equated with being irrational. And I think that's often because of it being sort of attached to women. So women are emotional, they're irrational, right? Okay, let's not go down that road, okay? Actually, latest thinking is that emotions generally lead to better thinking, maybe not in the moment. If you're in a moment where something, you know, either very scary, exciting is happening, that might be a bad time to make a good decision. But as time goes on, if you are emotional and invested into something, you think about it more thoroughly, you care about it. So the emotional part means you care about this, you're thinking about it longer, more thoroughly, and you're likely to make a better decision in the end. Not a better necessary at the moment decision. Strong empathy and emotions often lead to more authenticity as a person. So, you know, what you see is what you get. And that's kind of what it is with me. I tend to be very open, and that scares some people and it's entertaining for others. I don't know, but I am basically, I'm authentic. I will tell you who I am and what I believe, and disagree or agree with you right from the start. And that tends to be sometimes socially not necessarily very liked in some cases because it's kind of scary. You can scare people off. But if you're meeting another SBS trait person, then oh my God, they're gonna love you, because people with SBS love deep conversations right from the start. We're really bad at that chit chat. So empathy, even though I'm like extroverted and I can talk a lot, but I don't know, I kind of take it deep really quickly with a really simple question. And like every movie makes some kind of like, I have a theory of like what the movie was going to, you know, is trying to say to me. And I just watched like some kind of thriller, you know, where everybody was just like shooting guns and stuff like that, which I don't like, by the way, because that overstimulates me. But I will find a meaning in that movie. Empathy is often associated with the caudate nucleus of the brain, and research has shown that highly sensitive people have a highly active area, that brain area is highly active. All right, sensitivity to subtleties. So people with this trait notice more because because of that depth of processing. They take what they notice and they combine it with what they have noticed all of their lives in detail, and often come up with unique new ideas. And that takes some processing, right? But that's creativity at its core. And Dr. Aaron said it nicely, combining ideas is in novel ways is the essence of creativity. Studies of this trait show more activity in the insula, which has often been called the kind of the seat of consciousness, because it brings together all of our inner and outer experiences. And thus a lot of people would seem to want to conclude that people with this trait are quote unquote more aware. That doesn't make them better or worse. They just seem to be more kind of in tune with the environment and their internal environment and external environment, and then combining it. Some childhood considerations. So differential susceptibility is just an individual differences to how we respond to the environment that we are exposed to. So basically differential susceptibility is our sensitivity to our environment, how in tune we are with it. So high sensitivity or susceptibility to environment has advantages and disadvantages, sort of like I mentioned before. An SPS child is more likely affected by everything that happens around them, everything, the good and the bad. The unsupported child will have a foundation for increased fear in the future. So the question again about anxiety, a supported child will have a foundation for more confidence and more freedom and less fear. Most adults with this trait tend to report that they were not understood as children by their parents. And they spend a long time then sorting that out. So it's very interesting, I'm sure, in the counseling environment. And it has been for my work too, because I kind of ask a lot of personal questions as a person, I'm sorry, ask a lot of personal questions as a doctor. That tends to be unusual because doctors like to get to the point, and that's what makes me a little bit different. And I would have to say I agree. Both of my parents. Too sensitive. You're too sensitive. I'm still too sensitive. I try to explain all of this to them. It's like, this is just, I cry when this, if I'm so sort of really emotional about something and a tear will go down and I'm easily can cry. They just can't ignore it. I want them to ignore it. It's like, I have no ability to stop my tears. And I wish so much sometimes that I could just stop and, be tougher and be able to say what I think and what I feel more clearly, or not say it at all. And unfortunately, by nature, I do. So children with SBS will easily be overstimulated and then act out, like I said before, so tantrums, irritation. And so they are often labeled as bad or and then are being punished. Go to the corner, you had a tantrum, something happened. It's really important to understand the reason behind the tantrum, behind the meltdown. What happened? As a parent, I feel like it's our job to figure that out, because then you can figure out, okay, is this a behavioral issue? Is this a discipline issue? Or is this an issue of how my child has just perceived a situation and maybe they felt scared or unsafe and had this meltdown? And it's very important to have discussions with your young, even very young children about this. Not at the time, but obviously after. And this is where the processing goes in. The child will process what has happened and will be very well able to tell you what happened later on. So it just, that time needs to be given. My nephew is most certainly a person with this trait, and most certainly not understood by his parents. Unfortunately, I love them, but I don't think they get it 100%. And I feel lucky to be there for him and have conversations with him. I saw him as a young 3-year-old being very articulate about things that have happened, and come back to me after incidences of misbehavior at 3-4 years of age, and then talk to me about them and what happened, and because of what he saw or how he was feeling, and safety reasons and things like that. And that's what can tell you a little bit more about your child.
I do have a question. I hope it's an okay time to put this out there. One of the questions is, how common is the SPS trait? And then we have another one after that too.
20% of the population, 1 in 5.
Okay, and then this is such an interesting topic. I can definitely relate. Thank you so much for your experience and being open and honest. And it looks like that's it. Wait, that's it so far. That's it.
Oh, well, that's a wonderful call. I appreciate it. So I'll continue because I'm I'm kind of losing energy a little because it's getting late, whatever, but I'm very passionate about this topic. And so I appreciate that it's opening some doors for some people. So now boys really struggle with this, right? Because they have a difficult time. There's a cultural and societal pressure that are placed more so on boys. They often become ostracized and humiliated if they, if they are found to be sensitive or like emotional, or they don't want to start playing baseball right away. They want to kind of wait on the sidelines for a little bit. Often children will be pushed, like I was saying before, they will be pushed forward. And then the child will feel not accepted and insecure. The relationship with that caretaker and family member or coach or whatnot is going to be an insecure one, because they won't feel that they can trust them, and they will internalize a lot. And this is for both girls and boys. Girls are pushed too, like go talk to them, go play. And it's okay if they observe it first. It's like observe your child too first to see what they are doing then next, to then make more of a decision of maybe they're a little bit scared, and then have that discussion about it. Oh, I'm sorry. I think, I'm going, whoa. I'm sorry. Work. So the work environment for people with this trait are very difficult. Oh my gosh, I already kind of shared a little bit of my story. I have no idea. I do have an idea. I do know how I ended up in the medical field. It was my dream, and I really care for people. I really wanted to care for people, and this was kind of like the best way. But there's so many aspects to me that are just kind of not what you would expect for a physician in the system, because the system is very square, and I'm not a square, I'm a circle. I never fit in. I was always pushed to be that square in medical school, medical training, and I somehow managed to make it through. And I did sort of force myself to fit a little bit, and then, but it just wasn't working. So once you're out of that very strict training environment, you can kind of relax and spread your wings a little bit, and do your own thing. People with this trait will thrive at work, especially if bosses are understanding. And bosses are actually, research are showing that employers are most pleased with people who have this trait, but very few know how to recognize these workers and how to support them. most individuals with SPS are very good workers because they have that tendency to really look at tasks very deeply and process them. They also tend to be those over volunteers because of that empathy and that the sensitivity thing that they feel like, oh, nobody wants to do this and it needs to be done, so let me just do it because I can, you know, kind of a thing. But they over volunteer themselves, therefore taxing themselves and overstimulating themselves. They're often very creative, and but not everybody is the same. Of course, there are exceptions to everything and every trait. So as most things in life, a person with SPS needs to have a very rigorous self-care to perform well, and they need to have the ability to stand up for themselves and say no, because no, this is too much for me. Even if, you know, Joe over here is saying, well, that wouldn't be too much for him, but it's too much for me because I need the time to regenerate. And we all need that time. Everybody, the 20 to 80% need self-care, need to, you know, fill up that energizer, you know, battery. But people with this trait need more time, and it needs to be very dedicated to that, to them, like specific to them, excuse me. People with this trait do not deselect themselves from leadership roles, which has been shown in research. So as I said, that actually people who do some internal work, they often go out and try something on their own. They are actually very good at being leaders because of their depth of processing and the attention to detail of like what needs to be done, and to delegate those things to others. And they know how to stand back and let others shine because they actually prefer that. They don't want to be out there doing everything because they know that they will overstimulate themselves and it's going to be too much for them. So they're very willing to look at each individual in their business, if they're opening a business, and let those people shine in their in whatever is you know, unique to that person. And that's how, you know, those good bosses, you know, with knowing their workers, it's just so important.
We do have a question since you paused for a second.
Well, I'm almost done. We're at the end. If you don't mind, I'll just finish up and then I'll take the question. Okay? So some misunderstandings and dangers is that some may think that, you know, with this trait, we're talking about some kind of special minority, where this is not the case. It's just a trait. 20% of the population has it. It's not a disorder, but it needs to be recognized, the recognition of differences, and it needs to be, there needs to be an increase in and encouragement of understanding of each other and teamwork, because we all have strengths and weaknesses. And this trait obviously has its strengths and its weaknesses. The overstimulation is not a strength, it is a serious weakness, you know. Paying attention, you know, being introspective and then being, you know, able to be maybe perhaps more creative is a strength. But you know, that can be said about everybody in different ways, in different manners. So basically, we all need to work together for a balance. And I can take I have just a little clip movie from the movie Sensitive, The Untold Story. It's very good. It's actually on Amazon Prime right now, if you want to watch it. I was surprised to find it there. And it is by Dr. Elaine Aron, and it is very well done. It's about an hour long. So if you feel interested in this and you don't want to head for the book right away or for the research or anything like that, then this is a good place to start. Let me just play this first and then I'll go to the questions, okay? Oops, but I didn't play it. I just went for it. I will play it, I promise. I got this.
Now know that during these early critical periods of great susceptibility to environmental influence, that children are enormously affected and set on developmental trajectories by their early experiences. And the kinds of support and care, predictability, routines, all of the things that we think of as giving coherence to life, the more children experience that, the better families become, the better communities become, and I think in the long run, the better societies become.
I always listened to my daughter. Always. Everything she felt, everything she had to say was important to me. I would always get down to her. I would always look her in the eyes, and I would always listen.
This is like probably the happiest time in my life because I really have a good understanding of who I am. And I kind of feel like my sensitivity, I view it more as a superpower than, something that is a defect about me, because it makes me able to connect to people. So I found that knowing that other people were like this, it removed a lot of stress from me, because then I was not constantly thinking that, I'm not right, this isn't how I'm supposed to be. It made me realize that it's okay for me to be like this, and people are like how I am as well.
As I got older, it's easier to accept myself for the sensitivities that I have, because I know at the same time those sensitivities have really kind of carved some things in me that I just think are just absolutely awesome. And the one I think if I were to point to just one, it's the leadership aspect.
Oftentimes, it's the sensitive people in our culture who are the pioneers, who are the oracles who see into the future and see what's coming in our culture. And we don't give them enough credit as guides to us, but instead demean them because they're different than we are.
What I would ask for from the non-HSP world would be mercy. Mercy and respect, for the love of God. Just respect for how much we as a trait, as a community of sensitives, how much we contribute.
Sensitivity clearly benefits the 20% and the 80% alike. But there's also the actuality of differential susceptibility, which means the sensitive gain more from a good environment and are most affected by a poor one. Right now, they are most noticed by the other 80% when they are being overly sensitive. Those with happier histories adapt and make their valued contributions, and only those close to them know they are different and that they grew up feeling a little flawed. Whatever their backgrounds, however, the highly sensitive see the subtle signs of what's coming and think about it deeply, more than others do. Our world is going through vast changes, some of them frightening, and many of them not clearly understood. We all need these sensitive minds and hearts, people like those you have met here, to study and reflect on our world as it is now. We really need them. And to the highly sensitive, I say, I beg you, speak out. You now know you are in good company. We can support each other. You are not the only one.
Hold on, I have to unmute. I said, I'm speaking out. That was hilarious. So I am not alone, and we're supporting each other. Okay, that is it. We can go to the questions. Before that, this movie, actually, I have as a community event next weekend on Friday night at 6:30 and on Saturday morning at 10:30, right here in this big room. Just a few people masked and everything, and everybody's invited. So you can you can look me up and check it out. It's on my website if you feel so inclined to watch the movie together. So you would be welcome. And now I will go. Let's go ahead with the questions.
Okay, so we've got, looks like we've got two one from Alexia, and that is, does the SPS trait need to be identified by a professional or can it be self-identified?
It can be with fair reliability self-identified, because there are some questions. So if you go to just the HSP website, it's gonna be like super easy to find, like the first thing on Google, or read the book. There's just a specific questionnaire, and the number of, and it's kind of like a screen, right? So it will screen you just like doctors screen you. So you can screen yourself, and then it's sort of, there is no, you know yourself best, and those around you know you. And I feel like the questions are specific, and if you read the book and you identify, then definitely that's something to discuss. And there are professionals, counselors and psychologists and physicians who are well versed in this, that you can find, so that you can consult with them if you need to. But the thing is that that's how I felt. I felt at first like, oh my gosh, what a wonderful, this would be like a wonderful answer for me, because it, like that would explain so much in my life that has happened. And I, as a scientist, of course, went through a very rigorous, process of looking at all the research and reading it, and going on conferences, going on gatherings, meeting I went all the way because it gave me such relief, and I wanted it to be true. Because it depathologized a lot of anxiety. And now I realize often I can tune in with into my body, and I do work with professionals who know about this trait and can tell me more about how I can help myself understand my body and my mind and how I work, so that I can zoom in and then find my self-care methods. So you can screen, evaluate, kind of say, yeah, I think this is it. And then find what parts work with you. It's not that you have to have like all, like super empath, like some people call themselves empaths, you don't have to be like super empathic and super deep processing and super overwhelmed or something all the time to meet criteria. It can be certain parts of that you can meet criteria. Does that make sense? I think that's my answer.
Alexia, do you feel like if you have another question, feel free to unmute yourself?
Yes. So yes, my name is Alexia, and I was the one that asked that question. And
Thank you, Alexia.
Of course. Well, first and foremost, amazing presentation.
Thank you, and thank you for sticking with me. I know we're going past, so thank you.
I would stick. Honestly, this was an amazing experience, because first and foremost, when you talked about the language stuff, as somebody who is multilingual, you touched on so many points that I like personally related to, especially the point where you mentioned how like people with who might be multilingual or bilingual might be perceived by others as maybe like slightly unintelligent or incapable and things like that. And I can't even tell you how many times that's happened to me, because as someone who has, multiple languages in my brain, when I speak, sometimes I can come off as I don't know what I'm talking about, or maybe I might stutter, or the way I formulate my sentences and words can come off as maybe like I'm incompetent or whatnot. And as as an upcoming professional, it definitely can shine a negative light towards me. But in all actuality, it's because I have more than one language running like at rapid speed
at the same time.
Exactly. And so it's not a matter of whether I'm competent or not, it's a matter of I have to filter through multiple language to get my thoughts and ideas out into words for other people to understand. And so, I've definitely been, in that situation where people might look at me like, wait a minute, what is she talking about? Or she doesn't make any sense. It's like, I try my hardest to make 100% sense when I talk, but sometimes, my thoughts and, words and ideas get the best of me, and then it's really hard to formulate those sentences. But I guess that was one point. I also want to know, when you talked about the SPS.
I feel it. I get you. And I'm sure you found that in my talk today. There were times where I fumbled, and it's like kind of the nature.
Exactly. I totally empathize with that.
Just have to slow down. I have this over my, it says slow down on my little thing.
Yes.
Yeah, because it's like, just chill. It's okay. Slow down.
Exactly. And then the one last thing is, when you were talking about the SPS and all the characteristics about the trait, I can't help but feel emotional and overwhelmed by this information because, a little self-disclosure, but I mean, as long as I can remember, I've always felt
you're not alone.
I've always felt different, odd, and I can't tell you how many times I've been to the pediatrician by my parents because they were concerned I was acting a certain kind of way and exhibiting all these behaviors that were quite unusual. And, nobody was ever able to diagnose me with the correct thing. And I was often seen as just, well, she's just a problematic child who needs a lot of attention. And so my parents took the sides of the medical professionals and not me when I would try to communicate to them at a young age that something was off, that I didn't feel like everybody else. And then growing up, and and that was a very negative experience during childhood. And my parents never ever took me seriously or listened to me. And I was still having these heightened sensitivities to all kinds of things. And then, fast forward to adulthood, I mean, lo and behold, I'm struggling with anxiety, panic disorder, depression. And I used to think that, this pathology that was put onto me by these professionals now in my adult years, like, it felt fitting. It was the closest thing to an answer that I was going to get. And I can't even begin to explain to you how grateful I am that you've brought this to my attention, which is why I asked the question, like, how do I go about seeking I guess support and
you have to come in and hang out with me.
I mean, honestly, you're probably going to hear a lot from me. You and I mean,
absolutely.
I have to put the brain further because this.
Gosh, I'm so easy to find my emails everywhere. I have my website. Just put my name in. Like, I don't know. I want to find you. Come watch the movie next week if you're, I don't know, with the COVID and everything. I know that's might be scary, or just communicate with me and we can talk on the phone, on Zoom, whatever, and then I can lead you in a direction and help you figure that out. And I'm so thankful for you for sharing that, because yes, I get you. Yes, because I had all those pathologies too. I was pathologized, and honestly, by now I do have some anxiety, and it does need to be managed in a certain way that's apart from like the SPS, but that's because of that, like you said, that a child with SPS, negative environment, or unheard child, that's what's going to happen in the future. They might be, there will be limitations.
Exactly.
And so then it's up to us as adults to kind of take over. It's like, that's what happened. They didn't know any better. It's okay, and you process your childhood, you process with your family. And like I said, my family too, and they still tell me, you're so sensitive, don't be so sensitive, Monika is so anxious, Monika thinks too much. Stop thinking about it, right? And it's no, don't. You just understand yourself. That's what you gotta do.
I mean,
Understand
honestly, thank you so much. You're definitely going to be hearing from me. Like, I'm trying to hold back tears because this is like huge.
Good.
This is like a
Yeah,
pivotal.
start with the movie and start with the book and start with me, wherever you want to start there. And I think the movie is a great way to start because it does touch upon all these things. And honestly, when you said, you know, this made you emotional, when I was putting this talk together, I literally cried several times.
I'm like,
because I was
I'm
like
on the verge of
reminding
tears at
myself
this
of
point, 'cause-
things. Like I was like, oh, this is what happened to me in residency.
Exactly. That's
You know, I
exactly
was
what I'm
just
going through right now.
really processing because I didn't really get to, you know, like I've been thinking about this straight for so long and kind of like about myself and things. But then lately I've been, you know, very busy and stuff like that, a little bit less attention to self. And this made me realize this, that like, oh my gosh, I need to pull back. I need to attention to self, you know,
Yes.
because I started getting so emotional about it again that like, okay, yeah, no, this is me. This really is. Yeah.
Absolutely. Thank you so much. I'm so grateful to you.
Thank you. Thank you. So
Okay,
glad
I
that
just
you were
want to
here.
say that we're getting quite a few messages that people are going to be dropping off. So
yes,
that's totally
Yeah, I
understandable.
know it's late.
We do have just a couple more questions. And the next one is from Monika. If Monika's still on here, do you see
Well, I'm here.
Monika Elmlund?
Something else.
Do you see a correlation between HSPs and adverse childhood experiences?
No. As in adverse childhood experience and therefore HSP? No.
Okay. All right.
Because that starts at so genetics start first, and then you got experiences, and then you've got consequences.
Okay, got it. And the next question we have is from Tanya, and she says, can you share with us how we can advocate and bring awareness into mental health field without labeling as a diagnosis, but education of what might present as a behavior issue, but actually SPS?
Mm-hmm. And I think the question answered itself, education. Because that's what I do in my practice, and that's what I've done, whether it's general pediatrics or behavioral issues. It was when a child came in with some symptoms, even like physical symptoms, and mom was for sure this is like a disease, and it's not. You know, what's my primary role as a physician or as a clinician? To educate. And so, and I think that's a role of a clinician in psychology, psychiatry, everywhere, school, is educate. You have to just and educate first yourself so that you're well versed and that you can make that you know, kind of assumption that perhaps you know, like there's this thing. And by the way, this is a wonderful, whoops, upside down, no, a wonderful book, The Highly Sensitive Child, that I recommend to start with if you're working with children and talking to parents. And there's a bunch of other books that are out now, but these two are kind of like the groundbreaking. So educate.
I think education is a great place to end. We are Governor State University, so education is our mission. So I think that's a wonderful place to end. I do want to just mention to you the final comment here from Terry, which I think is awesome. This discussion has blown my mind. I'm definitely going to do some research on SPS. I think my whole life has just been explained in the last hour and a half. So, wow. I mean, it's awesome. It's really awesome. So
oh my gosh, I'm going to be like super overwhelmed. I'm like really blown away by those comments. I'm so happy. I'm so happy, even if it's 2 people, you know, like so happy. So yay, go out there. You're supported.
I guess we'll just end it here. Thank you so much. Unless anyone has any final comments. Shannon, did you have any final comments?
No, thank you for doing the presentation. And thank you, Michelle, for moderating.
Yes, thank you, Michelle. So there are references, so they will be, so I will send out all of this. Of course, I will, whoopsie, how did that happen? Of course, my last slide was a video, but we don't have to go there. It's okay. Unless people want to, but we really don't have to.
I leave it up to the folks still hanging. And
how about can I play it and then people can just drop out?
Absolutely.
If they want to watch it, they will watch it, and it's just a few minutes, and it's just deep for me. So it's kind of a selfish.
And anything that you would want me to share with the registrants, I'd be happy to do so if you send me the links. And that's exactly what we'll do. You play the video and folks can drop off as they need to.
Okay, sounds good. So thank you very much, everybody, for being here. I really appreciate it, for sticking for so long with me, and listening to me chatter and all sorts of things. And I'm just trying to play it with starting at this slide. And I'm really I'm just tired. Current slide. No, not last slide. This slide. How about I just play it like this? Whoops. See, that's what happens. Okay, bye everybody. Here's the last.
Hunter Adams. You've been accused of practicing medicine without a license. It's a very grave charge, son. Are you aware that it's unlawful to practice medicine without a medical license?
Yes, sir, I am.
Are you aware that running a medical clinic without the proper licensing can place both you and the public in a great deal of danger?
Is a home a clinic, sir?
If you are admitting patients and treating them, physical location is irrelevant.
Sir, will you define treatment for me?
As treatment would be defined as the care of a patient seeking medical attention. Have you been treating patients, Mr. Adams?
So I live with several people. They come and go as they please. I offer them whatever help I can.
Mr. Adams, have you or have you not been treating patients at your ranch?
Everyone who comes to the ranch is a patient, yes. And every person who comes to the ranch is also a doctor.
I'm sorry.
Every person who comes to the ranch is in need of some form of physical or mental help. They're patients. But also every person who comes to the ranch is in charge of taking care of someone else. Whether it's cooking for them, cleaning them, or even as simple a task as listening. That makes them doctors. I use that term broadly, gentlemen, but is not a doctor someone who helps someone else? When did the term doctor get treated with such reverence as, oh, right this way, Dr. Smith, or excuse me, Dr. Scholes, what wonderful foot pads, or pardon me, Dr. Patterson, but your flatulence has no odor. At what point in history did a doctor become more than a trusted and learned friend who visited and treated the ill? Now, you ask me if I've been practicing medicine. Well, if this means opening your door to those in need, those in pain, caring for them, listening to them, applying a cold cloth until a fever breaks, if this is practicing medicine, if this is treating a patient, then I am guilty as charged, sir.
Did you consider the ramifications of your actions? What if one of your patients had died?
What's wrong with death, sir? What are we so mortally afraid of? Why can't we treat death with a certain amount of humanity and dignity and decency and, God forbid, maybe even humor? Death is not the enemy, gentlemen. If we're going to fight a disease, let's fight one of the most terrible diseases of all, indifference. Now, I've sat in your schools and heard people lecture on transference and professional distance. Transference is inevitable, sir. Every human being has an impact on another. Why don't we want that in a patient-doctor relationship? That's why I've listened to your teachings and I believe they're wrong. A doctor's mission should be not just to prevent death, but also to improve the quality of life. That's why you treat a disease, you win, you lose. You treat a person, I guarantee you'll win no matter what the outcome. Now here today, this room is full of medical students. Don't let them anesthetize you. Don't let them numb you out to the miracle of life. Always live in awe of the glorious mechanism of the human body. Let that be the focus of your studies and not a quest for grades, which will give you no idea what kind of doctor you will become.
Mr. Adams, please turn and
Don't
address
wait
the
till
board.
you're on the ward to get your humanity back. Start your interviewing skills now. Start talking to strangers. Talk to your friends. Talk the wrong numbers. Talk to everyone.
Mr. Adams.
And cultivate friendships with those amazing people standing in the back of the room. Nurses that can teach you. They've been with people every day. They wade through blood and shit. They have a wealth of knowledge to share with you. And so do the professors you respect. The ones who are not dead from the heart up. Share their compassion. Let that be contagious.
Mr. Adams, I demand that you turn and address the board.
Sir, I want to be a doctor with all my heart. I wanted to become a doctor so I could serve others. And because of that, I've lost everything. But I've also gained everything. I've shared the lives of patients and staff members at the hospital. I've laughed with them. I've cried with them. This is what I want to do with my life. And as God is my witness, no matter what your decision today, sir, I will still become the best damn doctor the world has ever seen. Now, you have the ability to prevent me from graduating. You can keep me from getting the title and the white coat. But you can't control my spirit, gentlemen. You can't keep me from learning. You can't keep me from studying. So you have a choice. You could have me as a professional colleague, passionate, or you can have me as an outspoken outsider, still adamant. Either way, I'll probably still be viewed as a thorn. But I promise you one thing. I am a thorn that will not go away.
Is that all?
I hope not, sir.
Thank you. Good night.
Thank you. Good night. Thank you for sticking in.